Hi, welcome to Checking In with Amy. My name is Amy Goldberg. I'm a registered nurse with Neighborhood PACE. PACE stands for Program of All-Inclusive Care for the Elderly, and the elderly are people who are 55 years of age and older. The goal of Neighborhood PACE is to keep people living in their home healthy, independently, and in an active manner. We service the areas of East Boston, Chelsea, Revere, and Winthrop, and Everett, and also Malden, Medford, Melrose, Stoneham, and Boston's North End. Today, our segment is on diabetes made simple. And my guests are Dr. Ashley Casey. Welcome.
Thank you very much for having me again.
And my pleasure. And Ashley's been on my show before. And also, we're bringing today two pharmacy interns. They're in their 6th year, and they're going to graduate in 2018. So I welcome Joanna and Miriam Abdelmalek, Joanna Nichols. And so I welcome you both to the show.
Thank you.
And we're thrilled to have you. So let me start by saying 29 million people have diabetes. That's 1 out of 11 people. Without changes, 1 in 3 adults could have diabetes by the year 2050. That's an awful lot of people. So let's talk about what is diabetes.
Well, put simply, diabetes is when you have too much sugar in your blood. And normally when you eat foods high in carbohydrates, for example, bread, fruit, and rice, your body converts that into a type of sugar called glucose. And that glucose is then brought into your muscle and fat cells by insulin, which is a hormone made by your pancreas. And when you have diabetes, your body either cannot make the insulin, it doesn't make enough of the insulin, or it's no longer sensitive to that insulin. So you don't have that insulin to bring it into your cells, and then it's left in your blood.
That is a wonderful example. Thank you for saying that. Let me simplify it even further for our audience at home. So you'll see here a slide where we have a cell, and on the cell there is a door. And every single cell in your body has a door with a keyhole. So glucose shows up to knock on that cell door to try and get into it, to absorb it for energy. But what happens is, with a normal person, you would have insulin produced and you have a key, and the key will open the door and glucose can happily go in and be utilized. Unfortunately, with diabetes, you'll see that there's no insulin, or there's not enough insulin, as Joanna was saying. So glucose starts to build up around the cell, and then what do we do for treatment? We'll get into that a little bit later, Amy.
Right, we will. So I know that there are 2 different types of diabetes. So let's talk about diabetes type 1 and diabetes type 2.
So like you said, there are 2 types of diabetes, type 1 and type 2. For type 1 diabetes, that's more seen in childhood. So you see a younger population with type 1 diabetes, and that's when their bodies completely destroy the insulin. So there's no insulin at all to bring in that glucose that you've eaten. But however, for our population, it's more towards type 2 diabetes, and that's when you're making insulin, but either just not enough insulin or it's not being used properly. And those are the 2 types of diabetes.
Another great explanation. Thank you, Miriam. I'm just going to simplify it even further, bringing it back to my other explanation. So if we think of that key example, if we have a patient with type 1 diabetes, they try and go to the hardware store to pick up their key to get into their cell. Unfortunately, the hardware store is closed and there's no keys left, and that's how you have to think about type 1. There's no keys available. With type 2 diabetes, it's a little bit different. So they'll show up at the hardware store, and then they just might not have enough keys to produce for you, or they're running out of stock. So that's kind of how you would think of a type 2 diabetic. So there's keys there to open that door, there's just not enough to get you in, or maybe they just don't fit properly.
This is simple. I like
Simple.
this. Yeah, it's easy. So what puts someone at risk for diabetes type 2, since we're going to talk mainly about that?
Yes, there are a variety of risk factors for type 2 diabetes, and first and foremost would be if you have a family member that has diabetes or a family history of type 2 diabetes, as well as being overweight, having a high-fat diet, not exercising, having high blood pressure, and the older you are, the higher risk you are at for type 2 diabetes.
Not great.
No.
So I think we talked about the older you are, the higher the risk. So diabetes with PACE, it's a wonderful mixture in that we have at our wellness center a diabetes support group that meets regularly. We also have all kinds of healthy cooking classes in order for people to learn how to read labels and make food that would be better than others without a lot of carbohydrates. We also have exercises, and it can be individualized classes, or it can be just personalized just for the participant. And then finally, we have a weight loss support group. And all of these things are ways for people, for us to work with the people to make sure that we decrease their risk. And it's all working in a positive manner. So my next question is, I just want to let you know, 1 out of 4 people do not even know that they have diabetes. So 1 out of 4 don't even know that. Hopefully it's not us.
Yeah.
Not one of us
So
here.
what would someone look for? Let's talk about signs and symptoms of diabetes.
So there's many types of signs and symptoms. It's all based on if you're able to see it quickly. So sometimes you're always feeling tired, you always frequently go to the bathroom a lot, or you're really thirsty or you're really hungry. Another big one is sometimes you might get a cut and that wound's not healing quickly. Or sometimes you might get blurred vision. So there are many different types of signs and symptoms. They're not very specific, but if you have multiple of them, it might be a red flag for you to watch out for those signs.
And one question I came up with when we were, planning this topic is, why do people get hungry? What is going on in your body?
So I can explain that a little bit. What happens is your cell starts to draw other nutrients and liquids, things like that, from the cell into the bloodstream where the glucose is starting to building up so that the glucose can get out of your bloodstream. So say, for instance, your cell has a lot of, hydration that will come out of your cell and go into the bloodstream, connect to the glucose to help get the glucose out of the body. So that will cause an increase in thirst, an increase in hunger, things like that, because your body is essentially starving itself for trying to meet the needs that insulin is not there to provide.
That's good to know. And also I know that when you said about not being able to heal properly, that's why we do diabetic foot care, to make sure that people who are diabetics have the proper foot care that they need. And all of this is all part of the PACE program. Another question is, we talk about high blood sugar. We call it hyperglycemia high. So tell me what the normal values are. Let's talk a little bit about numbers.
Yes, well, like we mentioned, high blood sugar goes hand in hand with diabetes because you don't have that insulin to bring it into the cells. And there are normal ranges depending on whether you've eaten or not and the time of day, and it's going to differ it's going to be very individualized between people. And the general goal or range for before you eat is going to be between 80 and 130. And then if you have eaten 2 hours after you eat, when you take your blood sugar, it should be less than 180.
Okay, and sometimes doctors say that they would like you to do a fasting blood sugar. So what goes into that and why?
So fasting blood sugar is when you haven't eaten for at least 2 to 4 hours. Typically, we say for our participants in general that we don't do a fasting blood glucose because it can put people at risk for falls, things like that. If they haven't eaten all morning and their appointment maybe is a little bit later in the day, we don't want them to come in having not eaten and have that risk of hypoglycemia, which is low blood sugar and falling. So typically we ask participants, if we're going to get that level, we ask them to do it themselves at home and test their blood sugar at home and get the first thing when they wake up. So they haven't eaten for, at least 8 to 10 hours if they are just waking up. So that's usually where we would get our fasting.
Right. Okay. And the next thing would be, let's talk about a hemoglobin A1C. Now we're getting a little bit more technical. And hemoglobin A1C, what is it all about?
So hemoglobin A1C, that's a blood test that shows your average blood glucose over the past 3 months. So the reason why it's the past 3 months is because your hemoglobin stays alive in your body for about 3 months. So when you see on your screens, there's a hemoglobin cell on the left and a hemoglobin cell on the right. On the left has less amounts of glucose, while the right has multiple amount of glucose stuck on it, and that contributes to the term high A1C.
Right.
So a goal for us, for any diabetic patient, is to have an A1C less than 7%. But for the elderly population, we would like to have them a little bit higher at less than 8, so then we don't have a risk of falling for those patients.
So basically, a hemoglobin A1C, there's really, you can't get around. If you weren't good with your blood sugars, it's going to show up.
Oh, you can't be sneaky.
You can't be sneaky, yeah. Because sometimes we ask patients how your blood sugar, oh, good, good. But when they do a hemoglobin A1C, there's no, that's really the gist of it, right? So now we need to figure out a way to manage diabetes at home. So how can we do that, and when can we do that?
Well, as you asked me. I actually brought a glucometer along with me. So they usually come in these neat little pouches, and they have a glucometer in here, testing strips, and a Lancet device. So first things first, before we even start touching this, we would go wash our hands, right?
Okay.
Step number 1, wash our hands. You never know what was on your hands. Maybe you were eating something you shouldn't have, like a sugary donut, and there's some glucose on your fingers, and that will actually affect the reading. So wash your hands, number 1. Number 2, turning the glucometer on. Pretty simple. Usually there's only 2 or 3 buttons on most glucometers, and there's many different types. This one happens to be a one-touch ultra. And what happens is you turn it on. Some require setup for coding, things like that, like this one. So you would actually, have an initial setup, setting up dates and times and things like that. A pharmacist or a provider, nurse, they're all very happy to help people set this up. So always feel free to ask if you're at home and you're not sure how to use it. This one, you have a coding. So there's usually a code written on the back, and that would be the code that you enter when you insert the strips. So you open them up, you insert a strip into the glucometer. You set it aside. Next step is the Lancet device. This, I think, makes people the most nervous. So you would take the cap off, you insert the Lancet on there. There's usually a little tip, like a safety tip. So you would remove that, but you would put it aside. And then you put the cap back on. So super simple. You want to just maybe set it at like 3 or 4 if it's your first time using. There's different settings, usually 1 through 7. The higher the number, the deeper it will go into your skin. So you would set this up. Once it's all in there and it's all ready, you pull this little device back, and you take it to the side of your finger. We say the side because the tip of your finger has a little bit more nerves. So people who are complaining of pain, the first thing I usually ask is, where on your finger are you testing? So there's a little bit less nerve damage, on the side of the finger. So you would do that, you put it there, you puncture your finger. A little teeny drop of blood will come out, and now, because you've already had that glucometer all set up, you bring the glucometer to that drop of blood, and it pulls it in, and it will give you a reading.
So you made it simple, but sometimes I know that people do that and then they hope for blood to come, little drop, but it doesn't. So tell me how we can help that.
So like I said, there's different settings. So step number 1, you can maybe increase the setting to a deeper level. Maybe you're not puncturing deep enough. If you did puncture it and there's still not blood coming out, some of the techniques are when you wash your hands, making sure you use really warm water, because that will help bring some circulation to your hands. Right. One of the other things we say is like swinging your hands, really, exaggerating your swing, and that will help bring some blood to the fingertips, as well as milking the finger is a common thing. So it kind of is like milking a cow, and you milk your finger and you kind of rub it gently up and down till the blood starts to come out of your finger.
So that's good.
Yeah.
Yeah, thank you.
You're welcome.
Make it somewhat appealing. So, not really. So let's talk. Sometimes your blood sugar goes up and down, and you think, I didn't really eat anything sugary today. So now why should my blood sugar be this high?
There are many things that can affect your blood sugar other than what you eat. And one of them being if you're sick. And being sick puts a stress on your body, and that can increase your blood sugar, as well as dehydration can increase your blood sugar. There are also medications that you may take that can increase your blood sugar. Examples would be steroids, antipsychotics, thiazide diuretics, and as well as statins for cholesterol, and those can increase your blood sugar. And it's also important to note that some medications can mask the signs of hypoglycemia. And hypoglycemia is when your blood sugar is too low. And when your blood sugar is too low, it can cause a variety of symptoms, including shakiness, anxiety, irritability, as well as an increased heart rate. And when this happens, you might realize that you have hypoglycemia because you have that symptom of a fast heart rate, but beta blockers decrease your heart rate. So that can mask that sign. So it's crucial to monitor your blood sugar and keep an eye on that if you're on a beta blocker.
Lot to take in.
Yes.
I know. So how is diet, we know what it is now, what causes it, but now what are we going to do to treat it?
Well, there's different types of things that we can do. In regards to medications, there's different types of medications. So there's either oral or there's injections. But a lot of times there's other factors to which medications you will use. So it can be based on the side effects of the medications that you can't stand, or the cost of the medication, or if your glucose is high just in the morning or just before you eat, you have to regulate it appropriately. But the main difference between all these medications and treatment options are their mechanism of action, or where they work in your body. Each one works slightly different from the next. So some could either make the insulin more sensitive or stop the glucose from being reabsorbed in your kidneys. So the main thing to take from that is that each medication is specific to you. So if one doesn't work, it's not the end of the world. Like, we can figure out something different for you that might work better.
This is great to learn all this. I think it's a lot of information for us to take in and for a patient to take in. So is there something from your perspective that we can summarize or take away from this?
Yeah, so on your screen at home, you should be able to see a body and medications and body parts and where they all work. So I know it's really complicated and we're not expecting viewers at home to memorize any of this, but basically it just shows you that all the medications work in different ways and they can either work fast or long term. And the purpose is to tailor the medications to you to make sure that you're satisfied with your course of treatment and controlling your blood sugar properly by management with your provider.
So let's just summarize about blood sugar, high and low, so we can get it.
Yes. Well, on your screen there'll be a yellow section, a green section, and a red section, and that's going to represent low, normal, and high blood sugar. And we can start with low. So low blood sugar, like I had just mentioned, would be hypoglycemia, and that's normally when your blood sugar is less than 70. However, between different individuals, it can vary. Whereas if your blood sugar normally runs high, you can experience hypoglycemic symptoms at a higher number than 70. So it's important to know that. But the symptoms, like I said, include shakiness, irritability, sweating, anxiety, a fast heart rate. And you want to test your blood sugar, and if you have low blood sugar, you're going to want to have 15 to 20 grams of fast-acting carbohydrates. And what are fast-acting carbohydrates?
Right.
Some examples would be 3 to 4 glucose tablets or a tube of glucose gel, fruit juice, half a cup of fruit juice, and there are many other examples that you can go over with your doctor and see what works best for you. And after you consume the 15 to 20 grams of fast-acting carbohydrates, you want to wait 15 minutes and test your blood sugar again. And if it's still low, you're going to want to have another 15 grams of carbohydrates. So that's with low blood sugar. And then there's the normal range of blood sugar, like we mentioned, and it's either between 80 and 130 if you haven't eaten, and then 2 hours after you eat, it should be less than 180. And then that's where you want to be, and your goal will be different.
Yep.
And then there's high blood sugar or hyperglycemia. So if you're above that, those ranges are above your personal goal that you set with your doctor. And it's important to realize that hyperglycemia, long-term high blood sugar, can damage your blood vessels. And it can, since blood vessels provide blood to your vital organs, it can cause you to have a higher risk of heart disease, stroke, kidney disease, nerve problems, and such as losing vision and such. So it's very important to know what the long-term consequences of that would be. And there will be times when your blood sugar is low, and there will be times when your blood sugar is high. So as long as it's most of the time within the normal range, that's going to be the goal.
Right. Thank you.
Wonderful. Thank you so much, Joanna. Just moving forward into other managements and treatments, I just want to remind our viewers at home that prevention is one of the most important keys to diabetes. You know, diet and exercise, as we discussed, and we have a lot of programs at our wellness center here at Neighborhood PACE. But also just once you're actually being managed for diabetes, those preventative measures shouldn't necessarily stop. So just because you have diabetes doesn't mean you can't continue to do that diet and exercise program, and that will help you manage the diabetes better and use less medication, maybe have lower doses, things like that.
So thank you.
Yes,
This
thank you
is
for having us.
Great.
Thank you.
I appreciate your time.
Thank you.
And I want to just say, Neighborhood PACE is able to do all kinds of things to help our patients. We have the use of our eye clinic in East Boston. We have our own podiatrist. We have the doctors and the nurses and the nurse practitioners and pharmacist, our own pharmacist on staff. And all of this together is part of PACE. There are no extra charges. Even the medicine, the insulin, the lancets, the glucometer, all of this is covered as part of the PACE program. So I think that's a very, very important thing to know. So going forward, if you would like more information, I would like to have you call 617-568-6377. So before I close, I want to say happy birthday to the both of my interns who are celebrating, one today and one was yesterday,
Yes.
I believe. So thank you.
Thank
And
you.
Dr. Casey, thank you as always. And I look forward to seeing you again. And so until we meet again, please be well.